something is not right. There is excruciating pain in the upper part of the abdomen. This is what happens when there is inflammation of the large gland behind the stomach, which secretes digestive enzymes into the duodenum or the first part of the small intestine immediately beyond the stomach. And that usually follows excessive consumption of alcohol, which unfortunately appears to be a growing trend among mostly young Kenyans who more often than not opt to unwind after their busy schedules with a drink. However, the social drinking can sometimes develop into heavy drinking. It is important to note that gallstones are actually the most common cause of pancreatitis, besides alcohol, as Dr. Fred Okoth, a specialist, will explain to us shortly. However, the less common causes include viral infection, for example, mumps, trauma to the abdomen or elsewhere in the body, vasculitis, that is inflammation of the small blood vessel within the pancreas, and pregnancy as well. Pancreatitis is less common in children, but if seen, abuse or abdominal trauma should be suspected. Also, people with diabetes should promptly seek medical care if they experience unexplained severe abdominal pain.
The incidence varies in different parts of the world. And with the industrialized parts of the world, you find that the pancreatitis is on the increase, with a range of about 10 to 20 per 100,000 cases per year.
How do you treat the condition then?
If it is just a simple pancreatitis without any complications, then you manage these patients with intravenous fluids. You keep them off food, as we said earlier, that when they take food, the intensity of the pain increases because the pancreas would want to secrete enzymes to digest the food.
Explain to us the management regime.
The patient may have to rely on drugs for a long period of time. And some of these patients become addicted to these painkillers because you may have to use drugs like pethidine. And these are drugs of addiction where the body gets used and the patient will just be craving for the drugs, even if the pain is not there.
Is there any stigma associated with this disease?
Other people who take alcohol, they don't develop pancreatitis, but you'll find that either they have a problem with the liver or they have a problem with the brain. So if you find that in your case it is pancreatitis that you are getting as a result of alcohol, I think one should not be shy to talk about it or to mention to other members of the family that I have been told that my condition is probably caused by alcohol.
Pancreatitis demands prompt medical attention because complications arising out of the condition can be life-threatening. Tom Mboya, Citizen Live at 9.